Months of isolation have taken a toll on Vermonters' mental health, and today there was powerful testimony to lawmakers about gaps in the system that prevent true recovery. State House reporter Devin Bates has more.
There's been a lot of awareness raised about the effects of this pandemic on people's mental health, and along with that, we're now seeing a significant push for additional resources and a seat at the table in state government.
There is no designated position within state government to think about and address suicide prevention. This position would oversee suicide prevention strategies throughout the state and maximize the impact of existing programs and coordinate alignment of efforts.
Advocacy organizations like the Center for Health and Learning want people with personal and lived experience recovering from a mental illness to have a bigger voice in shaping the framework of Vermont's mental health system, and a bigger role in helping those who are currently struggling through peer support.
Soon after moving to Vermont, I discovered a peer support group run by NANI Vermont, and that changed my life.
Dan Toll is now a peer specialist. He said expanded peer support services would help others follow his path to recovery. The issue, however, is that it hasn't been easy to grow a larger network.
Next, state statutes governing the practice of mental health professions should be amended to remove barriers that artificially restrict the scope of activities of peer support workers.
Others said that immediate support for individuals suffering from a mental health crisis needs to be strengthened, and commonplace strategies and how to interact with those individuals needs to change.
Where do people go to get immediate help? Do we continue to keep bringing people to the emergency room? No. We need to invest into crisis stabilization programs.
Kareem Chapman is the executive director of Vermont Psychiatric Survivors. He said emergency room visits are often followed by other setbacks that can shatter someone's ability to recover from a mental health crisis.
There's no reason why we have someone in care and can't have a healthy transition when they're leaving and going into a home or some kind of support. Having someone leave a facility and be homeless is just not right.
Devin Bates, Local 22 News.